How to remove a mouth ulcer. Mouth ulcers can be aggravating and downright painful. Also called canker sores or aphthous ulcers, mouth ulcers can occur for many reasons. They may pop up during periods of stress or illness. Fortunately, there are many simple remedies you can try to get rid of them on your own, and if they still do not heal, you can seek professional medical care. Method 1. Trying home remedies. 1. Rinse your mouth with a saltwater solution. Mix a teaspoon or 2 of salt with a warm glass of water and let it dissolve. Swish the solution in your mouth from side to side, then spit it into the sink. Don't swallow the salt solution. Repeat this a few times a day, generally after meals and before you go to bed. 2. Try a baking soda mouth rinse. Baking soda is an alternative to a saline rinse. Dissolve a teaspoon of baking soda in half a cup of warm water. Perform the rinse the same as the salt water rinse. 3. Rinse with mild mouthwash. Rinse out your mouth to clear out any aggravating bacteria and potentially ease the pain of the sore. Just about any mouthwash will work for this purpose. Swish it morning and night, and maybe after lunch as well. Never swallow mouthwash. 4. Use milk of magnesia. Get milk of magnesia from your grocery store or pharmacy. Gently dab a little bit onto your canker sore several times every day. This can have a soothing effect and promote healing. 5. Dab the sore with hydrogen peroxide. Make a mixture that is half water and half 3% hydrogen peroxide. You only need a small amount. Dip a cotton swab in the solution and dab it over the sore. Do this once to clean the area, then dip a fresh swab and hold it to the sore for a few seconds. Try to do this morning and night. Don't swallow the solution, use just enough to wet the cotton swab. 6. Apply some honey to the ulcer. Dab a small amount of pure honey onto the ulcer. This may help ease pain and reduce inflammation. Dry the area with a clean cotton swab first, then use a fresh swab to apply the honey. 7. Make an herbal mouthwash. Infuse some water with equal amounts of the herbs sage and chamomile. Once the water cools to a comfortable temperature, use the mixture as a mouthwash. Some people find this to improve the pain of mouth ulcers, though there isn't much research on the subject. Use this mouthwash 4-6 times a day. 8. Drink beneficial juices. Some people find that carrot, celery, and cantaloupe juice helps improve mouth ulcers. This hasn't been studied, however. Juice these individually or blend them into a smoothie to enjoy on a daily basis. Method 2. Improving comfort and healing. 1. Suck on ice chips. Ice can reduce swelling and numb the pain of a canker sore. If you can, use your tongue to hold a chip directly against the sore until it dissolves. Keep ice chips in a coffee thermos or a styrofoam cup to prevent rapid melting, and use them throughout the day. If ice chips are too cold for you, try to at least drink cool water throughout the day. Let it sit in your mouth and gently swish it against your sore before swallowing it. 2. Stay away from acidic and spicy foods. Spicy, acidic, and abrasive foods can irritate the sore. This will cause pain and may delay healing. Eat bland and soft foods to let your ulcer heal. Avoid carbonated drinks, citrus fruits, hard foods like toasted bread, and anything with a lot of salt or spice. 3. Be gentle when you brush your teeth. Avoid aggravating your sore by grazing it with your toothbrush. Use a toothbrush with soft bristles and try to avoid touching the sore. Get toothpaste for sensitive teeth like Biotene or Sensodyne Pronamel to use until your sore heals. 4. Take over the counter pain relievers. If you can't get rid of your mouth ulcer as soon as you'd like, you can at least try to improve your comfort. Take an over the counter pain reliever like ibuprofen, or use an OTC numbing gel. These are available at your local pharmacy. If you have any medical conditions or take other medications, talk to the pharmacist or your doctor before choosing a medication. Don't take aspirin if you're under 18. Never give aspirin to a child. 5. Suck on zinc lozenges. You can obtain zinc lozenges from your local drugstore or pharmacy. Though these haven't been proven to be helpful, some people find that they ease discomfort and speed up healing. Use them as directed on the package. 6. Try vitamin supplements. Vitamins B and C may help to heal mouth ulcers, though this needs to be studied further. Get vitamin supplements from your drugstore or pharmacy after speaking with your doctor or pharmacist. Only take the recommended amount. 7. Take supplemental lysine. Lysine, an amino acid, could potentially help with your mouth ulcers. This needs more research, however. Ask your doctor or pharmacist if there's any reason you shouldn't take lysine. 8. Take echinacea. Echinacea is an herb that can be found in supplement form at your local pharmacy or drugstore. Because it acts on the immune system, it may help promote healing of canker sores. Talk to your doctor or pharmacist about whether it's safe for you to use echinacea. Method 3. Seeking professional treatment. 1. See your doctor if the sores are large or extremely painful. Most small canker sores heal on their own in a week or two. You may need medical help if you have multiple ulcers, very large ulcers, your pain is severe, your sores do not heal after 3 weeks or they spread, or you develop a fever. See your doctor or your dentist. There are many medications and treatments that can help. Your doctor or dentist can help you make sure your problem is actually a mouth ulcer, and not a tooth abscess or a rare form of oral cancer. 2. Ask for topical pain medication. You can get some pain medications over the counter, but others require a prescription. It's best to ask your healthcare provider which medication is best for you to use. There are numerous pastes, creams, liquids, and gels on the market that can ease the pain and speed healing of mouth ulcers. Use a product containing one of the following ingredients: fluocinolone, Lidex, Vainos, benzocaine, Ambisol, Canker, Zolactin, B, Orabase, hydrogen peroxide, Oragel antiseptic mouth sore rinse, Peroxil. 3. Request a medicated mouth rinse. If you have multiple ulcers, a mouth rinse may be easier than applying gel to each individual sore. Ask your doctor or dentist about getting a mouth rinse containing dexamethasone or lidocaine. These can both ease pain, and dexamethasone can also reduce inflammation. 4. Take pills if your sores won't heal. You may need oral medication if your ulcers don't heal with other treatments. Talk to your doctor about your options, and let them know about your health history and any medications you take. Some medicines for other ailments can be used to treat stubborn mouth ulcers, such as sucralfate, carafate, and colchicine. Your doctor may prescribe oral corticosteroids if you have severe ulcers that won't heal. These can have many side effects and are usually a last resort. Alert your doctor if you're pregnant or breastfeeding, or if you have an autoimmune disease, you might be better suited to another treatment. 5. Get your ulcers medically cauterized. Your doctor may cauterize your ulcers with a chemical or instrument. This destroys the damaged tissue, and may relieve pain and speed healing. Ask your doctor or dentist if this option is right for you. 6. Take a supplement to prevent recurrence. If you're low in any nutrients, your mouth ulcers may return. Talk to your doctor about whether you should take a supplement for folate, vitamin B12, vitamin B6, zinc, or any vitamins. This may help prevent recurring sores. Your doctor can check if you're deficient in any nutrients by taking a blood sample. Tips. If your canker sores are related to another illness, you will need to treat the underlying cause to prevent ulcers from recurring. Canker sores are not the same thing as cold sores. Cold sores are caused by the herpes virus, canker sores are not.